So the state of Florida is rejecting those federal guidelines. Dr. Joseph Ladapo is the Surgeon General of the state. We're happy to have him join us tonight. Doctor, thanks so much for coming on. So why are you rejecting these guidelines?
Yeah, that's a good question. We're rejecting the guidelines because we think they're harmful to kids. And I say that both as a professional, as the Surgeon General of the state, but also really on a personal level. I mean, you look at the scientific evidence that the Biden administration has based this recommendation on, and it's so thin, it's appalling. And to be making such a really a powerful recommendation. I mean, this is not trivial. These are not trivial interventions. These are major interventions, major life-saving, major life-changing interventions.
Yes.
With such little data. I honestly don't know what's happening over there, but we, here in Florida with Governor DeSantis, we can't stay silent when recommendations that make no sense or in fact likely to be harmful are being made.
Is it ever, and tell us as a physician, are there data supporting the idea that it is ever medically necessary on the basis of emotional reasons to remove the breasts of, say, a 13-year-old girl?
Right. So it's definitely a complicated issue. I think to answer your question, I think the things that we think about include the fact that, first of all, and this is something that's not publicized, but it's been shown in multiple studies. When adolescents express an interest in being another gender, feeling that they're not in the right body, believe it or not, about 8 out of 10 of these children will essentially stop having that desire, stop feeling that way later in adolescence or in young adulthood. 8 out of 10 of them basically move beyond having those feelings.
They don't want to be astronauts either, of course.
So it, right. So it's complicated, but the right answer and the whole, everything about it is complicated, right? Obviously, but the right answer is not to be subjecting children to therapies like puberty blockers that we don't fully understand the implications of, or surgeries that are irreversible. I mean, that's just not that's not where you land after you evaluate the body of evidence.
Yeah, I mean, sterilizing children, that's a big step. So maybe we should pause. I appreciate the reasonable perspective you have on this, and I'm sorry that people are denouncing you as a hater. It seems just the opposite to me. Doctor, thank you.